What's up, everybody? My name is Berg, here to make you fall in love with all things physical therapy. And in today's video, we're going to talk about my outpatient clinical rotation experience. Oh, and I'm going to share with you 2 tips that you can use for your next rotation. Let's do this. So today's the last day of the clinical rotation. I know, time flies. So this is my routine every Tuesday. I wake up at 5:30, try to eat some breakfast and leave the house before 6:30 to catch the train. Usually I get to the hospital around 7:30, 7:45, and to debrief with our CI before we start observing. And we usually stay in the hospital till from 8 to 12. And then after 12 we leave, and then we go back to school for our evening lab or afternoon lab. So the rotation this time lasted a bit longer than the inpatient rotation I had in the fall. I believe it was about 12 weeks. And if you didn't know, I made a video about my inpatient clinical rotation experience. I recommend you check it out right now, or after you watch this video, or whenever the hell you want. You decide. Guys, I'm all about outpatient. So when I walked into the PT department of the hospital, seeing the gym area, the TheraBands, the towels, the giant container of hand sanitizers, man, it felt great. So I was there for 45 hours every Tuesday, and I saw about 5 to 6 patients. Treatment usually lasted about 30 to 45 minutes, and the demographic of the people we saw, vary across the board. I was supposed to sit down in one evaluation every Tuesday, but let me guess, that did not happen for you, right? Yeah, I mean, it did happen, but just not all the time. Let me guess, that didn't happen for you at all. Dude, all I wanted from this rotation was to conduct an eval, and I couldn't even do that because patients just keep canceling, man. Bro, you tell me you didn't see a single eval? Come on. Not a single one, bro. I mean, these things are beyond your control, There's just nothing you can really do about it, and I'm sorry. Yeah. Just tell the viewers what kind of cases you saw in there anyway. I'm sure they want to hear about that a lot more than just, me complaining. All right. So yeah, what did I see in there? We saw a patient with lower back pain, patient with pelvic misalignment, patient with total shoulder replacement. We saw a couple of people with trochanteritis bursitis, plantar fasciitis, and we even saw people with pain shooting down their leg and arm. I also saw a patient getting excited because they could see and feel how they progress. I saw people crying because of fear of losing their independence. I mean, I've seen enough in those 12 weeks, man, to confirm again how amazing physical therapy is. Think about it. It always surprises me just the amount of changes we can bring into somebody else's life. It's crazy. And how did the school prepare me for this? Let me show you. So yeah, we played around with the vertebrae and the spinal cord itself. Got in on the reflexive hammer secret. And in this one, this was a movement analysis. I was basically trying to pick this piece of paper from the floor and people observing my spine as I did that. This is horrible. This is a C-curve. It should not be like that. Shame on me. And in this one, they were trying to teach me how to keep my spine neutral in the quadruped position. Believe it or not, this is much harder than it seemed. I was having a really tough time. And then we played around with each other's pubic symphysis. Yeah, I was really not a fan of that one. No. Then we did some lumbar traction, learned a couple stretches. And in this one, Josh was trying to realign Julia's pelvis. Believe it or not, after you do a couple stretches in class, you can actually hurt yourself. And then this one, we're trying to learn the knee anatomy. And then here, this is ankle exercises, extreme. And this is a test for radiculopathy. Oh, fake babies. Yeah. And then we learned how to crack backs, which was fun. Obviously, we did more, but I don't want this video to be like 15 minutes long, so I removed some of the footage. If you'd like to see more of what I do in class, let me know so I can make more videos like that. Or, just follow me on Instagram because everything is just there. One of the way I maximized my outpatient clinical rotation was to have my CI email me the cases that is going to see 1 or 2 days before I'm around. That way I can just review the pathologies, or try to remember the patient that I saw like last week, because my memories these days is not doing so well. When I get those emails, I come up with better questions to ask my CI, or just come up with exercises to progress the patient that I'm going to see. Which brings me to, make sure you tell your CI exactly what you want to get out of this rotation, because depending on what kind of CI you get, you might end up doing a lot during the rotation, or you might end up doing absolutely nothing. I mean, for me, I wanted to get exposed to documentation a little bit and do a little bit of an evaluation, and I did get to do all of that. Thank God. But JB, on the other hand, he had a rough time. You don't even understand, bro. Like, my CI wouldn't let me do anything. Like, how am I supposed... Internship's coming up in like 2 months, right? How am I supposed to get confidence if I'm not doing anything at my rotation? I mean, all I did was just observe, man. Observe every time. Like, I did that as an aide before I got into PT school already. Like, meanwhile, people in our class are getting so much hands-on experience that it's like they have their own panel. Meanwhile, I'm over here, like, getting observation hours and stuff. It's about time you end the vlog too, man. It's been like, what, it's been like 10 minutes already? Man, been trying to read this article, but can't do it because of your damn takes and your camera. Just saying it already. Man. all right. Let me take this outside. So, this is the end of our clinical rotation experience. Like I said earlier, we're trying to go back to school and get something to eat before we start our afternoon class. So far, this has been the best clinical rotation so far. If you guys didn't know, I'm all about outpatient, so anything ortho related pleases me. What else do I gotta say? Yeah, in 2 months we're gonna go into our first internship experience, and I believe a lot of you have been asking me if I feel ready. Make sure you feel ready. I believe I know a lot, but I also don't know a lot. So I don't think you'll never be 100% ready. The best thing you can do is really jump in and adjust. All right, see you guys later.